Namaste all. Today we are going to learn about the three most important formulations that we use in our daily practice. I am Vaidya Adarsh PM from Samhidi channel. What are those three important kashayas that come under Rasnadithrayam? Rasnadithraya refers to three classical Ayurvedic kashayas centered around Rasna or which starts from Rasna, etc. and primarily indicated in Vata Vyadhi, especially in musculoskeletal and neuromuscular diseases. Though widely prescribed, that is Rasna kashayam, Rasna Erandadi kashayam, and Maha Rasnadi kashayam, although they are widely prescribed, their specific therapeutic focus and depth of action differ significantly. First, we will move on to Rasna Saptaka or Kashaya. Actually, this for understanding the therapeutic action of a drug and its specificity, we have to understand three important factors. The first factor is the prakarana in which the quad is mentioned. Here, the prakarana is Amavata prakarana by Chakravatta, and the next factor is the key ingredients and their therapeutic actions. The ingredients are Rasna, Amrita, Araguda, Devadaru, Trikantaka, Erenda, and Punarnava. The last factor is the Anupana is used because in most of the cases the Anupana used is as per the stage and state of the disease. So then we will go on depth to the therapeutic action of the ingredient drugs. Rasna, as we all know, it is Agriya. It is the excellent medicine for Vata. That is Agriya among Vata Shamana. And Amrita also we all we know it is also Vatahara, it is Deepana and Kapha Rekta Prashamana. Also, this medicine is Vishashamana in nature. Aragada will provide us Mrutu Virejana, Sramsana, Vishashamana and Koshta Shuddhi. Devadaru is Kaphavata Shamana and Shofahrit. Trikandaka is Bhakti Shodhana and Brahmana. Eranda is Vadashamana, Vatanilomana, Vrishya, Shobhara, etc. Punarnava is Shotahara Vishashamana. So, on observation, you can see that most of the medicines here are having Shotahara property, and most of the medicines here are having Vishashamana property also. All we know that Amavata is produced by Amavisha. It is exactly mentioned in the sloka. So that Amavisha Shamana, the Visha medicines are combined here. And Amavata for Samavata condition, Pajana is necessary so that some Pajana medicine and Shotaharana medicines are also included for subsiding the inflammatory conditions. Now we can move on to the specific therapeutic activity of Rasna Saptaka. So, in order to understand the specific therapeutic potential of a medicine, we can go through the third factor also, that is the Anupana. Anupana is here used is or Anusevya, which here used is Shundi Churna. So all we know that Shundi Churna is Pachana and Deepana in nature, and it can be used in Samavastha of many diseases, including Amavata and so many autoimmune conditions. We can indicate Samavastha Shamana, that is Amapachana medicines, along with Vata Shamana. So the indications which are mentioned in Rasna Sapta Khwad are Jankoru, Trikaprushta, Parshvashula. So Jankashula, Urushula, Trikashula, Prishthashula, and Parshashula. These are mentioned in simple terms, but we have to deduct the exact idea what the Acharya intended. And the Jankashula and Urushula, we know that it is respectively the calf region and the thigh region. So there is an acute inflammation and pain on these regions, and it can be due to autoimmune myositis, fibromyalgia, etc. So it is due to Sama Avastha. So we can indicate Rasna Saptakwan there, and it is affecting the Vada Roga sthanas. Trikashula we can correlate with the pain which is affecting on the Trika part. Trika is the part most accepted like it is on the lower back region where the three bones joins together. And there we can indicate like ankylosing spondylitis, reactive arthritis causing sacroiliitis. All these are acute inflammations which are affecting on that region. Prishtashula is again can be due to the inflammation which is present on the vertebral column, that is all through the vertebral column or spinal cord. So we can say that it is affecting the whole backside, It can be due to ankylosing spondylitis, myositis affecting paraspinal muscles, or multiple sclerosis. All these conditions, there is inflammation and pain. Parshashula is dermatomyositis. Parshva is like we can say that the lateral side of the chest or lateral side of the abdomen and flanks. So there the muscle inflammation will be there, which can be acute or autoimmune. So dermatomyositis, ankylosing spondylitis, rheumatoid arthritis, all these are causing acute muscular inflammation and pain on that region. So in all these conditions, we can compare it with Samavata, and the indication of Rasna Saptaka is in Samavata condition. So the Anupana used is Shuddhi Churna here. Definition on our Rasnadithraya is Rasna Erandadi Kashaya. So it is the most misunderstood in therapeutic depth among these three kashayas. It is indicated in the Prakarana, that is Vata Shonita Prakarana, Vata Rekta Prakarana. We can see Rasna Erandadi Kashayam. Then we will move on to the ingredients. Rasna, Eranda, Bala, Sahajara, Shatavari, Dusparsha, Vasha, Amrda, Devataru, Adivisha, Musta, Kopilaksha, Shati, Shunti. So all these kashayas are either Vata Shamana or these are Rekta Dushya Shamana in nature. So Rekta Dushti can be due to either due to Pitta aggravation or due to Kapha aggravation. So we can use this kashaya in conditions where vata is vitiated in dekta and associated with kapha or pitta. So that is the indication of this kashaya. To understand this more deeply, we can see the reference of Anupana. The Anupana mentioned here is either Sarpi or Taila. So there is a Vadarekta condition where there is uh, Pitta Anubandha is there. That is Pitta Adhika Vadarekta, which is told in classics. There we can use Ghee as the Anupana. Or Taila is mentioned. Taila is mentioned in conditions where there is Kapha Adhika Vadarekta. The Kapha is dominant dosa which is associated in Vadarekta. So in Vadarekta there is already a Vata vitiation, Rekta vitiation and Pitta vitiation. And the Rekta vitiation can be due to Pitta or Kapha. Based on the Kapha Adhika Vadarekta or Pitta Adhika Vadarekta, we are changing the combination with Anupana. Anupana is changing. So the Anupana is mostly in almost all cases it is indicated as per the state and stage of the disease. And the other indications which are mentioned in the sloka is Vayu with Shula or the Shobhamja Vadasrajam, the Shofa which is produced due to Vadarekta in different locations. So it can be used in the conditions where Vata is vitiated in Dekta and associated with doshas. So disease specific condition we can see gouty arthritis is there. In gout we can indicate non-inflammatory stages of rheumatoid arthritis where we suspect recta vitiation and we can give in non-inflammatory state because we can't indicate sarpi or thaila as anupana in inflammatory status, and the medicines are not supposed to do samavata, or medicines are not supposed to do pajana here also. So we can indicate it in non-inflammatory stage of rheumatoid arthritis. In osteoarthritis also we can give, in lumbar spondylosis we can give, in bursitis, in tendonitis, these are due to acute strain on the tendons. So in that cases also acute strain, acute injuries, etc., there will be vada aggravation in recta. So recta vitiation and vada aggravation is there. So it is producing a similar status of vada recta. So we can indicate the kashaya in these stages, and inflammation followed by acute injuries. All these are associated with vata vitiation and recta vitiation. So Rasna Erandadi kashaya are indicated in these scenarios. Our next focus will be on Maha Rasnadi kashaya, and it is also indicated in Vataroga Prakarana. The key ingredients are Rasna, Bala, Eranda, Devadaru, Shati, Sahajara, Prativisha, Ashwagandha, Gokshuda, Vridhadaru, Shatapushpa, etc. The most of the medicines in this combination are Vata Shamana in nature along with Kapha Shamana. So Vata, Kapha Shamana kind of medicines are mostly associated with this medicine. and there is also the presence of Brahmana and Belya medicines. All these indicate that this medicine is specifically indicated for diseases where there is degeneration is in predominance. In this page also you can see many of the ingredients are Vata Kapha Shamana in nature, and some of them are Vata Pitta or Pitta Shamana in nature, and Shatavari is there which is Brahmana in nature, and Pitta Shamana Vasa is there. So when we are taking the in totality, if we are taking the whole medicine, we can see that the medicine is having a leaning towards Vata Kapha Shamana property. On further analysis of the Anupana or Anusevya medicines, we can understand a range of conditions where Vata and Kapha are predominant in cases. Like here, the Anupanas or Anusevyas mentioned are Ajamoda, Shunti, Pippali Churna, Yogaraj Gugulu, and Eranda Taila. These are the Anupanas mentioned for Maharashnadi Kashaya. So we can indicate Ajamoda in a condition where this is like Kapha square plus Vata I mentioned. Like Kapha is having double the grade. So this is a grade of doshas where Kapha, when there is maximum Kapha and then Vata is already there because it is a Vata Roga mainly, and Kapha is it is in a double grade, then we can say that Ajamoda can be given as Anupana. If Kapha is the first grade, then we can give Shunti, and if Vata is the predominant dosha and Kapha is associated, where Kapha is on the second grade of association, then we can give Pipali Churna. And Vata is there and Kapha is on the first grade of association, then we can give Yogaraja Gugulu. And air under the eye is also mentioned as an Anupana, where Vata plus root Kapha, square root of Kapha, I mentioned, because it is, we cannot say that it is when Anupana is here under the ila, it is indicated for Kevala Vata. We can't say that because for Kevala Vata conditions, we can give Sneha itself. We don't need to give Kashaya in that stage. So here the square root of Kapha is mentioned, Vada plus square root of Kapha. So this is the logic of selecting different types of anupanas along with yoga, along with Maharashnadi Kashayam, and you will see such a range of patients in your clinic also, where you can see different permutations and combinations of these doshas and their grade or status. Based on the indications given in Maharashnadi Kashaya, we can deduct so many pathological conditions which are similar to that indications. For example, the indications given are Sarvanga Kamba, Pakshakada, Ababahuga, Gridrasi, Amavada, Ardida, Shukramaya, Metraroga, and Vandya. Sarvanga Kamba, we can say it can be either correlated to Parkinson's disease or in hyperthyroidism also there will be Sarvanga Kamba, and it is due to Kevala Vada or Vada associated with some little bit of Kapha or something like that. In Pakshakada, hemiplegia we can indicate. In Apabahuga, cervical radiculopathies, TOS, thoracic outlet syndrome, brachial plexus injuries, all these are in can be correlated with Apabahuga. Gridasi, sciatica or lumbar radiculopathies are there where there will be association of kapha and vata is the main dosha. Amavada, rheumatoid arthritis. So we can indicate this kashaya in Amavada also, especially during the a non-inflammatory stage, that is on the degenerative stage of this disease we can indicate. Ardita, in Ardita also facial palsy also there will be either due to vata predominance or there will be some kapha association are there, then we can indicate this kashaya. Shukramayas including the seminal disorders, premature ejaculation, etc., which are due to the prakopa, aggravation of vada in shukra. We know that in aggravation of vada in shukra can be manifested in different ways. Either Shukra Kshaya will be there or Shukra Sangha will be there due to the obstruction. So, or the yearly pakada of yearly ejaculation will be there in as a Shukramaya. And Metra Roga is erectile dysfunction can also be due to Vata pathology. And Vandya in female infertility cases such as polymenorrhea, frequent menstruations within a time period, or yearly perimenopause, which is causing in some adult population, or hypothalamic dysfunctions. All these are related to Vandya along with the Vada aggravation. So Vada aggravation, we can see these kind of diseases where there is Vata aggravation and there will be associated kapha also. We can indicate the specific kashaya. If one disease is indicated in kashaya, that doesn't mean that this kashaya can be used in every stage of that disease. So, in the first stage of rheumatoid arthritis during acute inflammation, we can't indicate Maharashnadi kashaya because it is not for the purpose of inflammation or pajana. So, pajana is the for pajana we can indicate other conditions. Here, for degenerative conditions, we can indicate Maharashnadi kashaya. So thank you for listening. If you are interested in such videos, you can like the video and subscribe my channel. Put your comments on the comment box. Once again, thank you. Bye.